PD-L1 testing is in fact a complicated story. So we have learned that PD-L1 expression can be very dynamic. So it depends very much at what time point you look at PD-L1. We know that PD-L1 expression by tumor cells or within the tumor microenvironment can be induced by an interaction between the immune system, T cells, and the tumor. So when T cells are arriving at the tumor site, they are activated, they may recognize the tumor, and because of that they may induce PD-L1 expression. So it's certainly not something that is always there. Could be, there's oncogenic driven PD-L1 expression, just to the an oncogenic event that occurs in a lot of tumors. But mostly we think that PD-L1 expression is induced by an ongoing immune response. So knowing that means that PD-L1 expression tells you something about the interaction between the immune system and the tumor. So it could be a very positive indication that an anti-PD-1 or anti-PD-L1 drug may work. But because it's dynamic and because we have several tests, it's a complicated test also, an immunohistochemistry complicated test. It means that you can have heterogeneous expression. Expression may come up later. Then you have looked, if you looked at archival material from a year before, at the time that you give the drug, expression may be completely different. So those are things we have to realize when we think about PD-L1 expression. Now, if you look at the outcomes of patients with either PD-L1 expression, no PD-L1 expression, or low PD-L1 expression, you see there's a difference. But there's not a clear-cut threshold for PD-L1 expression you need in order to get a good response to an anti-PD-1 or anti-PD-L1 drug. Therefore, I don't think that PD-L1 expression is a very good biomarker to select on.